Hey friends, how you all been doing? I am Dr. Ann, an anesthetist, and welcome to another dose of happiness and health. I upload videos every weekend, so if you haven't subscribed to my channel, subscribe so that you will be notified of new videos each weekend. So today I am going to be talking about why your anesthetist recommends you, not recommends you, but why you have to be on an empty stomach when you're going to get surgery, why your anesthetist wants you to be on an empty stomach. So let's dive into the video. So if you are getting ready for surgery, you might have been told by your surgeon that you should eat nothing the day of surgery. You shouldn't even drink water. I'm sure you must have heard those recommendations, or if that is the case when you are posted for surgery in the morning, or if your surgery has been posted in the afternoon or in the evening, your surgeon and anesthetist would have told you that you should not have anything to eat or drink at least 6 to 8 hours before your surgery. So you must be wondering, why do they do it, and how the heck am I supposed to do it? It's so hard, right? Not being able to drink water, not being able to eat, so it's quite a hard task. So let us see how. First I'll talk on how to get through hunger, and then we'll talk about why your anesthetist wants you to be on an empty stomach. So you won't be angry at an anesthetist for making you starve. So let's have a look at how you can get through hunger. So there is this misconception that skipping food is bad for your health, that you should never skip food, you have to eat breakfast, lunch and dinner. But in this age and time, there's this new research coming in that intermittent fasting is good for you. Skipping breakfast is not bad. If you want to lose weight, you can skip a meal or two. It doesn't matter as long as you're fasting. It's much better when you're fasting. So with all these information right now, so I think it's much easier for us anesthetists to tell a patient to skip their breakfast, and it's not a big deal now. But sometimes maybe you're not an intermittent fasting person, so you might really find that your anesthetist telling you to skip your breakfast very hard. So I thought I'd share a few tips about hunger and how your body works and all the basics behind it, so you will know that it's not a big deal skipping one meal, skipping the meal before surgery, skipping a meal or two, or even skipping a meal every day to lose weight. It's not really a big deal, and if you want it, you can do it. It's not going to hurt your body. At first I'll talk about hunger hormone. There's this hormone ghrelin, which is our hunger hormone. When our hunger rises, the ghrelin level raises, and people think that when your ghrelin increases, it increases and goes off the roof. So you might think like, I'm going to be hungry, more hungry, and what's going to happen now? But that's how you thought, right? But that's not how ghrelin works. How your ghrelin works is when it is time for you to eat, like all of us eat almost at the same time every day, and that's how ghrelin works. It's like a clock inside to get a body ready to eat, and this is how ghrelin works. It goes up, and it's the maximum when it's time for you to eat, and then goes back down. So if you're actually fasting to get ready for anesthesia or just plain intermittent fasting, this is how ghrelin works. It goes up and it goes down, so there's nothing to worry. It's not like you're going to be hungry throughout the day, you're going to be hungry the whole time, you're going to be so hard, it's going to be so hard, your stomach's going to hurt, it's going to be a terrible feeling hungry all the time. But that's not how it is. The ghrelin goes up and it goes down and it wanes away, and you'll totally forget that you didn't have a meal. So it's not something to be concerned about. So the next time you're skipping a meal, you might have seen, right, sometimes when you're too busy and you're doing something else, and you just went past your time to eat and you totally forgot to eat, and it really did no harm, because your ghrelin went up and it went down, and it's down now, and you really don't have to eat. So it's not really that big of a deal having to deal with hunger there is this phase where you might feel really, really hungry, but if you go through it, it's going to be fine. But sometimes you might feel a bit lightheaded, you might feel dizzy. In those cases, you might have to rest a little bit if you're waiting for surgery, because you're not allowed to have food or water. But to prevent that, it would be really nice if you had a really protein rich meal the night before, so that your blood sugar won't fall the next day morning. And coming to coping with hunger, I know it is quite hard. You feel like you're dying inside and you just don't want to fast for surgery. It's true, I mean, all of us are getting surgery, we're stressed out about the surgery, but still in the back of the mind you're also hungry. And if you're someone who likes eating for comfort, it's gonna be even more harder for you when you need to skip your meal. So when you keep thinking about it, it's going to be really hard for you. So it would be really best if you don't have food in your mind. Like if you have something that you should not do, like you're going to have a piece of candy and you're thinking, I should not eat this candy, I should not eat this candy, I should not do you are going to eat this candy, because that's not how it works. If you don't want to eat a candy, you just put it somewhere out of sight and then you forget about it, and then you go about doing something else. You have to distract your mind, you have to put the candy in a place where you don't see it. And you can also ask your family and friends to help you out. I mean, they can keep your mind off food if that's what's bothering you. And even the anxiety of surgery, if you have family over, it will be really nice and relaxing to talk about something else, to take your mind off all the worries and the anxious thoughts you might have before surgery. And that's so those are ways in which you can help take your mind off food. But if you were intermittent fasting, you can have, of course, black coffee, black tea, green tea and all. But if you're fasting for anesthesia, then you're not really allowed to do that also. So I'm so sorry about that. You will have to fast, be on a really strict fast, not even a water fast. Now we'll see why your anesthetist tells you not to have food or water the night before surgery. I've already told you, like when you are given anesthesia, the medicines that you give anesthesia, it relaxes all your muscles, and that's why you're not able to move during anesthesia. That's why you're not feeling pain for anesthesia, and it is a good thing that your anesthetist it's a good thing that your anesthetist gives you anesthetist, because without anesthesia, it's going to be, your surgery would be really painful. And there are some effects of anesthesia, right? And that's why your anesthetist tells you not to eat your food on the day of surgery. So if you are going to, if you have a look at our throat, you see a throat, right? And inside the throat is a windpipe and also a food pipe. So both of them are in a throat. The windpipe is in the front and the food pipe is in the back. And there is a cartilage called the epiglottis, which covers the windpipe. It's usually open, but when you are swallowing food, the epiglottis will come and close the windpipe, so that food does not go into the windpipe. Of course, you might know, you would have guessed by now what would happen if food goes into the windpipe, right? It will go inside the lungs, and if food goes inside the lungs, it's like it's going to damage all the alveoli, all the structures in the lung, and your lungs will get infected, and that will take a really long road. That's a really long road to recover from. So that's the basic anatomy. So when you are given anesthesia, all the muscles relax, I said. So all the epiglottis, there are muscles which control the epiglottis, which open it and close it, open it and close it. And when you are given anesthesia, all your muscles relax. Especially during general anesthesia, it's not, the effects might not be seen for regional anesthesia or local anesthesia. But for general anesthesia especially, the muscles in your neck also will not be working, and if you have your stomach full of food, the sphincter in your stomach won't be contracting, and the food from your stomach will come up and come into your neck, and then the epiglottis is also not working. So from there, from your food pipe, the food will enter into your windpipe, and it's going to cause a lot of complications. So especially for general anesthesia, you are not supposed to have even water. on the day of surgery. But for regional anesthesia, you never know, right? Sometimes you're gonna be on regional anesthesia, so it's not a problem if you have food or not. You're gonna be awake. Like if you're having surgery in your hand, you're just gonna be anesthetized. Your anesthetist will be anesthetizing only your hand, and it's not a problem, you might say. But that's not the case, right? Sometimes you might be so anxious during anesthesia, and you might start shivering, and you might be so scared of what's happening. You might be hearing what the surgeon's talking, and that might scare you out a bit. So you might ask your anesthetist, I'd like to sleep for surgery. I'd like to sleep when my surgery is going on. So your anesthetist might have to give you medications to make you sleep, and in those cases, again, we give general anesthetics, but not in the full dose. But still, you are being given general anesthetics and drugs to make you fall asleep, and that will also relax your muscles. And sometimes you might have pain during surgery. The surgery might be taking quite a long time, and you might start to feel pain, and your anesthetist might have to make you sleep. And in those cases, if you have a stomach full of food, that won't be possible because your anesthetist cannot do that. So that's why anesthetists recommend you, not recommend. That's why you should not have food in your stomach or even water, or you're not allowed to have food or water on the day of surgery. So before we end, I'm going to put a table up here about the recommendations for children, because it's a bit different for children. It's very hard for children to fast. So but you might be asking, what about my child? They are small children, and how can I not give food for them? They're going to be crying all the time. What do I do for them? How do I comfort them? But this thing I have to tell you again. I already told you, if you have food in your stomach, it's going to come up into your food pipe and into your windpipe, and your anesthetist will not risk having that happening. And so you should not give food for your children as well. But there are guidelines where you can have water, and you have to confirm that with your anesthetist. So when you're going for your pre-anesthetic checkup, I advise that all of you talk with your anesthetist, get an idea of what should be done, what should not be done, how long. Like if your anesthetist says your surgery is at 8 o'clock, so you can have water till 12 o'clock in the night, then you can have water till 12 o'clock in the night, and that will be easier for you and for your child. And you can always distract your child. You can talk about something else, you can play with your child, you can distract them. And your surgeon and anesthetist know that it's very hard for your child to undergo surgery and to be on an empty stomach and not being able to eat and all. So if there are a few patients who are going to be having surgery, if there's a child and then 3 more adults having surgery, your surgeon will always schedule your child to be first, unless there are other reasons when that is not possible. But if there are no other reasons, your child will be first on the list, because it's hard for your child to have to be on an empty stomach. So you don't have to worry about that. But if you have some concerns, I highly recommend you to talk with your anesthetist, talk with your surgeon. Like, we are here to listen to you and to answer all your questions. You don't have to keep everything in your mind and Google everything, and that's not how it works. So if you have any queries, you have don't forget to write them down, because sometimes when you go for a visit to the anesthetist, you might go all blank and forget everything that you want to ask your anesthetist. So have a list of all the questions you want to ask your anesthetist if you have been posted for surgery. And everyone is kind. No one is going to think that you're asking a silly questions. Like, we understand that everything is hard. So if there are any concerns, talk to your anesthetist. We're all friendly people. We're all there for you. So I hope that this video helped you out to learn a little bit about why we should be fasting. And it's not a big deal. Don't freak out that you're not allowed to eat. It's gonna be fine. It's gonna be fine. People are doing it. People are doing it all the time. It's not something new. And if you do have concerns, talk with your anesthetist. We're always there for you. Talk with your surgeon. Talk with your nurses. We'll be helping you out. All of us over here are there to help you out only. So see you again in the next video. Don't forget to subscribe if you like the video, and tell your friends if there's someone going for surgery and needs to be and if someone is going for surgery and needs to be told that it's okay to be on an empty stomach, share this video with them. And let's see you again next week. Bye.